So in sole dissection, I have given the skin incision, reflected the skin along with the superficial fascia. Deep fascia of the sole, which is also known as the plantar fascia, I have just removed it. Now the first layer of the sole is exposed. The muscles are, three muscles are there in the first layer. The first one is abductor hallucis, second one is abductor digiti minimi, and the third one is flexor digitorium brevis. This one is flexor digitorium brevis, which has 4 tendons. You could see here the 4 tendons of flexor digitorium brevis. Now to expose the muscle of second layer, I have just reflected the flexor digitorium brevis. Now the muscle of second layer is exposed. Now see the muscle of second layer. This one is, let me fix it first. So after reflecting the flexor digitorium brevis, the second layer of sole is exposed. The muscles are, first it contains the tendon of flexor hallucis longus. So flexor hallucis longus tendon, then tendon of flexor digitorum longus. This is tendon of flexor digitorum longus, which is divided into 4 tendons. You could see here the tendons. This is one, this is one, this is one. So it divides into 4 tendon for lateral 4 fingers. Then the third muscle is flexor digitorium accessorius, which is inserted on the lateral side of flexor digitorum longus tendon. The fourth muscle of second layer of the sole is lumbricals. So 4 lumbricals are there, which take origin from the long tendon, that is the flexor tendon. The first one is unipinnate, rest are bipinnate. So this is one, this is one, this is third one, and this is fourth one. The second, third, fourth is bipinnate, but the first one is unipinnate. Now come to the muscle of third layer. So I have not, to show the muscle properly, I have to sacrifice all these, but I have not just cut it down. Just see from here what you could see. This is flexor hallucis brevis, the muscle below the tendon of flexor hallucis longus. This is flexor hallucis brevis, and flexor digiti minimi is not exposed here. And what you could see here is one tendon of the fourth layer is the tendon of peroneus longus. This one, this tendon, the white one, this tendon. This is the tendon of peroneus longus, which take turn from this side and now changes direction from lateral to the medial side. So this is the tendon of this one, the white one, this one, this tendon. This is peroneus longus tendon.